Hello class, welcome to another pre-recorded lecture. Today we'll be talking about substance-related disorders. And when we're talking about substance-related disorders, we're talking about, 10 separate classes of drugs are, these disorders encompass 10 separate classes of drugs. And number one is alcohol, two is caffeine, three is cannabis, four is hallucinogens, five inhalants, six opioids, seven sedatives, hypnotics, and anxiolytics, then eight stimulants, nine tobacco, and 10 other or unknown substances. So the substance-related disorders are divided into two groups, which are substance use disorders and substance-induced disorders. So let's talk a little bit more about substance-induced disorders. These conditions may include intoxication, withdrawal, and other substance medication-induced mental disorders such as psychotic disorders, bipolar and related disorders, depressive disorders, anxiety disorders, obsessive compulsive and related disorders, sleep disorders, sexual dysfunctions, delirium, and neurocognitive disorders. So those are the substance-induced disorders. And so again, we're talking about also substance use disorders. And the substance use disorders can be applied to all 10 classes of drugs, described earlier, except caffeine. And these are based on pathological pattern of behaviors related to the use of the substance. So again, this is pathological, behavior. So we'll talk more about that. The essential feature of a substance use disorder is a cluster of cognitive, behavioral, and psychological symptoms indicating that the individual continues using the substance despite significant substance-related problems. So the person, even though there are a cluster of symptoms related to cognitive, behavioral, and psychological symptoms indicating problematic use or significant problems, the individual continues to use the substance. An important characteristic of substance use disorders is an underlying change in the brain circuits that may persist beyond detoxification, particularly in individuals with severe disorders. So again, with substance use disorders, especially for those who are, severe, what we do see is that there is a change in brain circuits. Also, we see that the behavioral effects of these brain changes may be exhibited in the repeated relapse and intense drug craving when the individuals are exposed to drug-related stimuli. And so again, the reward circuit of the brain is triggered because of the, repeated use. And so the craving is that the individual is seeking the next fix. So we have what you call alcohol use disorder, which is a problematic pattern of alcohol use leading to clinical significant impairment or distress. So again, is problematic alcohol use that contributes to clinical significant impairment or distress. So we also have cannabis use disorder, which is a problematic pattern of cannabis use leading to clinical significant impairment or distress. So we have hallucinogens use disorder, a problematic pattern of hallucinogens, example, phencyclidine use leading to clinical impairment or distress. Another is inhalants use disorder, a problematic pattern of use of a hydrocarbon-based inhalant substance leading to clinically significant impairment or distress. And these individuals may experience impairment in terms of occupational impairment, social impairment, and other types of impairment. Also, we have opioids, a problematic pattern of opioid use leading to clinically significant impairment or distress. Also, we have sedatives, hypnotics, and anxiolytics, which is a problematic pattern of sedatives, hypnotics, or anxiolytic use leading to clinical significant impairment or distress. So notice that these substance use disorders, they produce clinically significant impairment or distress in the users. Stimulants use disorders, a pattern of amphetamine type substance, such as cocaine or other stimulant use leading to clinically significant impairment or distress. Tobacco use disorder, which is a problematic pattern of tobacco use leading to clinically significant impairment or distress. So we have other or unknown substances use disorders, which is a problematic pattern of use of an intoxicating substance not to be classified within the 9 categories which I just talked about a while ago, and leading to clinically significant impairment or distress. So again, this disorder is outside of those 9 categories that I just shared a while ago. So it's other substances or unknown substances, separate from the 9 that I just named. So let's talk about the prevalence of substance use disorders. So I will share in this presentation data from the 2020 National Survey of Drug Use and Health based on the Substance Abuse and Mental Health Services Administration 2021 report. So tobacco product use or nicotine vaping. So in 2020, 20.7% of people aged 12 or older, or 57.3 million people in the US use nicotine products, use tobacco products or vape nicotine in the past month. So how many? 57.3 million people. Among past month users of nicotine products, nearly 2/3 of adolescents used, let me say that again. Among past month users of nicotine products, nearly 2/3 of adolescents aged 12 to 17, which is 63.1%, vape nicotine, but did not use tobacco products. So we see that again, 2/3 of the adolescent in this survey, 12 through 17, they are involved in vaping. In contrast, 88.9% of past month nicotine product users aged 26 or older use only tobacco products. So we see that vaping is prevalent among the 12 to 17-year age group, and we see that nicotine products such as are more prevalent among the 26 and older age group. So let's talk about alcoholic use. In 2020, 50% of people aged 12 or older, or 138.5 million people, use alcohol in the past month. So how many? 50%, which is 138.5 million. And that is age 12 and older. So current users, and those are the current users, 138.5 million individuals from age 12 and older. Among the 138.5 million people who were, current alcohol users, 61.6 million people, or 44.4%, were classified as binge drinkers, and 17.7 million people, which 28% of recurrent binge drinkers, and 12.8% of recurrent alcoholic users were classified as heavy drinkers. So again, so of the 138.5 million, what we find out is that 61.6 million people were classified as binge drinkers, and 17.7 million people were classified as heavy binge drinkers. So let's talk about illicit drug use. In 2020, 21.4% of people age 12 or older, or 59.3 million people, use illicit drugs in the past year. And so again, that is 59.3 million people use illicit drugs in the last year. That is including 17.9% of those who use marijuana. So of those who are, 21.4% are the 59.3 million people. 17.9% of those users are marijuana users, comprising of 49.6 million people. And so we see among those who are illicit drug users, we see that marijuana is the drug of choice. And those who are, abusing illicit drugs, we see that marijuana is high among the drug list. The percentage of people who use marijuana in the past year was highest among young adults aged 18 to 25. And so that is 34.5% of that population. So the 18 to 25 age group, their drug of choice is marijuana, compared with 16.3% of adults aged 26 or older, and 10.1% of adolescents aged 12 to 17. So again, we see that 18 to 25, their drug of choice is marijuana. Among people aged 12 or older in 2020, 3.4% or 9.5 million people misuse opioids in the past year. So again, 9.5 million people misuse opioids in the past year. Among the 9.5 million people who misuse opioids in the past year, 9.3 million people misuse prescription pain relievers, and 902,000 people use heroin. So again, let me say that again. Among the 9.5 individuals who abuse opioids, we see that 9.3 million of those users misuse prescription pain relievers, and 902,000 people used heroin. Let's talk about initiation of substance use. Among people aged 18 or older in 2020, 1.3 million people initiated cigarette smoking. So again, 1.3 million individuals initiated or started cigarette smoking. And then we see 4.1 million initiated alcoholic use, and 2.8 million initiated marijuana use, and 1.2 million initiated prescription pain reliever misuse in the past year. And so these are all new users in those categories. The vast majority of people who are past year initiates of cigarette smoking or alcohol use tried cigarettes or alcohol for the first time before age 26. So those are significant. In contrast, nearly 2/3 of past year initiates of prescription pain reliever misuse were age 26 or older when they initiated misuse. So again, about 2/3 of those who were initiates of prescription pain reliever in 2020, we see that 26 year or older were initiates. Let's talk about perceived risks from substance use. So perceived risks from substance use, we see that only about 1/4 or 25% of people age 12 or older in 2020 which is 7.4% perceived great risk or harm from smoking marijuana once or twice a week. So those who perceive harm from smoking marijuana are that they are at great risk. We see that only about 1/4, which is 27.4% of those users believe that marijuana can harm their health or harm them. And, that's a problem. So let me just reiterate that. About 1/4 of people age 12 or older in 2020, which is 27.4%, perceived great risk of harm from smoking marijuana once or twice a week. Young adults age 18 to 25 were less likely than adolescents age 12 to 17 or adults age 26 or older to perceive great risk of harm from smoking marijuana. So again, we see that 18 to 25 age group, they are very comfortable with marijuana use and they are less likely to perceive that marijuana can harm them or that there can be great harm that can result from the use of marijuana. So let's talk about mental illness and substance use treatment. Mental illness and substance use treatment. So again, in 2020, 17% of adolescents aged 12 to 17 or 4.1 million people had a major depressive disorder in the past year. And 2.7% or 644,000 people had a co-occurring major depressive episode and a substance use disorder in the past year. And so again, co-occurring, we see that 644,000 who had major depressive episode also had a substance use disorder in the past year. An estimated 6.7% of adults age 18 or older in 2020 or 17 million people had co-occurring any mental illness and substance use, and 2.2% or 5.7 million people had co-occurring serious mental illness rather, and a substance use disorder in the past year. So let me reiterate that again. So 17 million people had a co-occurring, with any mental illness and a substance use disorder. So they had both illnesses at the same time. So 17 million with any mental illness and a substance use disorder at the same time. And also we have 5.7 million who had a co-occurring serious mental illness and a substance use disorder at the same time. So let's talk about substance use treatment. In 2020, 14.9% of people age 12 or older are 41.1 million people were classified as needing substance use treatment in the past year. So 41.1 million people were classified as needing substance use treatment. So they needed treatment for their substance use. And so among people age 17 or older in 2020 who needed substance use treatment but did not receive treatment at a specialty facility in the past year, 97.5 did not feel that they had needed treatment. So again, only 2.5% of those who received treatment felt that they got the treatment that they needed. And so again, we see that this is a major issue. About half of adults age 18 or older in 2020 with a co-occurring substance use disorder and any mental illness in the past year receive either substance use treatment at a specialty facility or mental health services in the past year, but only 5.5 received both services. So notice again, so of that number that had a co-occurring mental illness with a substance use disorder, we see that only 5.5 7% receive both mental health services and also substance use treatment. And that's a significant issue right there. And so, because what happens is that, you know, if you're treating only the substance use, you know, disorder, you know, they also mental health, the mental illness is also impacting the patient. And so it's very important that both, illnesses are considered at the time of treatment, and that both are accounted for in treatment. About 2/3 of adults age 18 or older with a co-occurring substance use disorder and a serious mental illness in the past year received either substance use treatment at a specialty facility or mental health services in the past year. But only 9.3 received both services. So again, so what we can see, 2/3, 66.4% who had serious mental illness and a substance use disorder receive, treatment. But of those who receive the treatment, we can see that only 9.3% receive both services. And again, so that's a problem, because what we do know again is that there can be that a substance can induce mental illnesses as well. And so it's very important that for those who have co-occurring disorders with substance, with a mental illness, with substance use disorder, that they receive both services, from specialty facilities. And it's important that they receive them at the same time. So let's talk about strategies for substance use recovery. The first is to refer the person to Alcoholics Anonymous. It's very important that the person, is referred to a place where that person can get support. And so Alcoholics Anonymous program has shown to have, good recovery. And so again, it's very important that we refer the person to Alcoholics Anonymous. Refer the person to a substance abuse treatment center or a substance abuse counselor. That is very, very important, because those individuals are specialized in, those facilities are specialized in treating substance use disorders, and also the substance abuse counselor also is a specialist in that area. We just talked about that. Refer the person to a substance abuse counselor. Also follow the 12 steps of Alcoholics Anonymous, which is admitting you are powerless over addiction. And so we can share these strategies with patients and their family members, and also with our team members. So the first step is admitting you are powerless over addiction. Believing in a higher power can also be significant to that person recovery. Surrender to a higher power. And as chaplains, we do this, and we can encourage these 12 steps as we share them with patients and family and their family members, and also team members. Take a moral inventory. Admitting wrongs, being ready to have a higher power remove your wrongs, asking a higher power for help. Make a list of people you have wronged, make amends, take personal inventory, engage in prayer or meditation, and practicing these principles and service to the community, which very, very important, in the recovery process. Manage your stress. So helping our patients and team members and their family members managing their stress can be helpful, because generally people abuse substance as a means of coping, but we know that that is not a good way to cope. And so some of the ways that the person can manage stress is to develop a structured schedule. A chaotic or disorganized lifestyle can also hinder, that person's recovery. It's important to develop a structured daily and weekly schedule and stick to it, because that structure will keep you accountable, and also it will help you to stay on track with the recovery. Focus on your finances. Financial troubles and problems finding, and let me say that again. Financial troubles and problems finding and keeping employment are major triggers for relapse. And so again, focus on your finances, because when addicts, they have, you know, financial struggles, they sometimes might, you know, be encouraged to go back to the behavior. It is possible to take baby steps and get your finances in order, even though we know that it's a challenge for, you know, those who have abused substance, but you can take baby steps to get your finances in order. So those are some of the things that, you know, you can do to manage your stress. Make sure that you have outlets, you know, like exercise and different things as well. Next one is to let go of resentment or emotional hurt, because some people, they not try to numb the pain, and that's the reason why some individuals have gone and they have abused substance, so because they want to just numb the pain. Identify your personal triggers, helping, you know, the patient or family members or team members to identify their personal triggers can be helpful. A big part of preventing relapse is understanding, you know, your, you know, external triggers, such as what are the triggers that will push you to, you know, back to that lifestyle. And those triggers can be, you know, people, places, things, and situation that elicit, and these triggers, they tend to elicit thoughts or cravings associated with substance use as well. Not only, you know, where you are aware of your external triggers, but also your internal triggers, such as feelings, thoughts, or emotions that are associated with substance use. Disassociate as much as possible with, you know, places, people, things, and situations that encourage the substance use. Replace unhealthy old routines and habits with new ones. So again, you're going to find new habits and new routines to replace those old ones. It stands to reason that if you quit your drug of choice but continue with your same routine, hanging out with the same people, you know, are hanging out with the same people and in the same places, and not make any changes in your circumstances, it will be much easier to slip back into your old behaviors and habits. And so it's very important that we replace those unhealthy habits, you know, unhealthy old routines and habits with new healthy ones. Build healthy relationships. This is very significant, because a lot of times, you know, those old relationships were not healthy, and as a result, they continue or they contribute to the relapse and so forth. So we want to build healthy relationships. Get support. You know, getting support. AA, Alcoholic Anonymous, is a good place to get support. You can get support from family members, from friends, and so forth. But remember, the support, you should get support from people who will help you to, you know, on your road to recovery, will help you to maintain a lifestyle of sobriety. Practice a healthy lifestyle. Practice a healthy lifestyle, such as exercise, you know, get involved in a hobby and doing different things, eating well, you know, fruits and vegetables, sunshine, fresh air, and those wonderful things. Practice a healthy lifestyle. Celebrate milestones. Celebrating milestones can be really good, you know, because, you know, it gives you a sense of accomplishment, and it reinforces those positive behaviors due to that sense of accomplishment. And again, celebrate milestones, because that will, you know, keep you going. It will give you something to celebrate, and it will also help you to look forward to the next step in the process. You know, I'll just close with this. 1 Peter 5 and verse 8 says, be sober, be vigilant, because your adversary the devil, as a roaring lion, walketh about, seeking whom he may devour. He wants us not to be sober. And so again, it's very important that we help our patients and our team members and also those we associate with to live a life of sobriety and also to be safe, sober. Because what we do know is that substance use disorders, it really affects our cognitive ability to concentrate. And as a result, we are in a state of where we are not thinking clearly. And so again, it's very important that we take this passage as an encourager. Be sober, be vigilant, because your adversary the devil, as a roaring lion, walketh about seeking whom he may devour. And so thank you for watching today, and have a wonderful afternoon.